anatomy education, right? Through scalable gamification. As we navigate modern challenges in medical education, finding innovative, scalable ways to bridge the gap for rural training is more critical than ever. We are thrilled to have a wonderful turnout of professionals dedicated to advancing anatomical sciences. So before we officially begin, let me just take you briefly through our timeline for the morning events so we can keep things running smoothly. We are sorry for the technical glitch once again, and that we're running a bit late. So I'm gonna cut the welcoming remark pretty short and hand it over to our speakers shortly. And we will end the presentation by 11 o'clock. And from 11 o'clock onwards, there is a dedicated Q&A question or session, followed immediately by a quick virtual photography session before we conclude the webinar. So please don't leave yet. After the Q&A, we need to capture your beautiful images and for the memory as well. So there's a bit of housekeeping note here for everyone. To keep the session interactive yet orderly, you are welcome to drop your questions into the chat box at any point during the presentation. Alternatively, you can use the raise hand feature during our dedicated Q&A block after 11 o'clock, so that our speaker can deliver the talk without disruption. And please ensure your microphones remain muted during the lecture to ensure that the best audio quality for everyone. Right. It is now my distinct honor and privilege to introduce our guest speaker for today, Dr. Yasid Matagasinger. Is that the right way to pronounce it?
Beautifully done.
Okay. All right. So Dr. Yasid is a medical doctor and a lecturer in the Department of Anatomy and Developmental Biology at Monash University, Australia. It's not a very uncommon name for me because my husband graduated from Monash himself.
All right.
Yeah, Monash, Australia, where he leads the graduate entry medicine anatomy program. He earns his MBBS with from the University of Colombo, Sri Lanka, sweeping distinctions and winning the Professor T. Viswanathan gold medal for excellence in clinical obstetrics and gynecology. He went on to complete his PhD in cell biology and neurosciences at Monash University, which was followed by a prestigious early career postdoctoral fellowship at the same institution. Dr. Yasid's research profile is exceptionally remarkable. He has published 50 Q1 peer-reviewed papers, including 46 original research articles, amazing over 16,000 citations on Google Scholars with a H index of 30. His publications span highly impactful work, including numerous collaborative pieces in The Lancet, Nature Medicine, and JAMA Neurology, alongside core educational papers in anatomy, science education, and medical education. Notably, his innovative contributions to pedagogical design, such as utilizing integrated gamification to reduce neurophobia in medical students, directly aligned with our team today. His exceptional dedication to driving medical education forward has been widely recognized, earning him multiple honors, including the Dean's Award for Innovations in Teaching 2025 from Monash University. We are incredibly fortunate to have him share his expertise on how we can scale up these innovative gamification tools to empower anatomy education in rural setups. Without further ado, please join me in virtually welcoming Dr. Yasid. Dr. Yasid, the floor is yours.
Thank you very much for your very, very kind introduction. And thank you for the invitation to present at your prestigious association webinar series. I am sharing my screen. Hopefully, you can see it clearly. Yeah, go. Awesome. Right. So, as you said, it's going to be short. It won't, I don't think it'll take all 1 hour to get through the presentation, but there's an interactive activity in the middle, and I hope everyone can help engage so that it'll be very interactive rather than me just talking. Cool. So my topic today is how we try to improve the rural anatomy education through implementing a set of gamified activities throughout the entire curriculum. We tried to figure out when and why we should implement gamification. Would it be at the beginning or the end as a revision activity? And we learned over last couple of years what would be a better approach, and I'm very happy to share those things, those ideas with you. Before I start, I would like to acknowledge the people of the Gunai Nations and Kulin Nations on whose lands I carried out this research in Australia, as well as people of the Otahutahi Nations, on whose lands I'm gathered today. I'm at the moment I'm in New Zealand attending a conference. So these are some beautiful pictures from New Zealand that my colleagues actually captured yesterday from Christina Boone from UNSW. So thank you for the pictures as well. Um, so this is the university that I mainly teach into. This is the Monash University Clayton campus, which is part of the metropolitan campus near Melbourne city. At the same time, I get to teach into these two nice rural universities, which are in Gippsland. So I had to drive on Monday, like 150 kilometers to get there and teach. We have a lovely cohort there. And then we have Mildura, which is 1.5 hours flight. The main problem that we had was it's great to have all these distributed curricula, but now that Australia and worldwide, even UK, they have an initiative to increase end-to-end rural curricula where the students study in rural settings, hoping that they'll stay in rural settings because we have a very high shortage of GPs in rural areas. That's why we try to do this. But the problem is we had to teach them online most of the times. And we go there and do intensive training and come back. But weekly teaching sessions, they are online. So we thought what would be the best way to make them more engaged through these gamifications and make it more scalable so that you can use it in multiple settings at the same time, also online versions. So when we asked these students, when they just started clinical years, how do you feel about the anatomy that you learned in your first year? They said, okay, we learned a lot in anatomy, but I have no clue how to apply them in clinical. So they mentioned that they have a distinct preparedness gap, especially because we teach ward round based activities in their clinical years. Even though they know a lot of anatomy, they don't know how to, integrate in an answer when a clinician asks questions regarding anatomy. So we thought, now, this is a concept that I was inspired by Dr. Martin Chadwick's keynote at ANSAPI. He was saying, so there is this signal and the noise behind it, and it's very difficult to figure out how to um, engage with or how to encapsulate the signal amidst a lot of noise. They learn a lot in their first or second years, and they don't know how to extract the knowledge that is necessary when it comes to clinical years, then and there to apply into patient. So, what do we really need uh, is is this clinically applicable knowledge? So we did a massive curriculum redesign, and over the last 2 years, we saw a massive change. Now our students are really, really engaged. And last year, we saw a 10% increase in their examination scores. And this year, we see a 20% increase. The median mark was around 89. I was like so overwhelmed with happiness when I saw their marks were going up. So mind you, it's not me giving them the questions before the exams. Some of these questions they are coming from this New Zealand and Australian common question bank, and I don't get to see them just before the exam. So this is to say that our question, the students are learning what's the best way to, um, you know, apply knowledge in their exams as well. And we did a qualitative study starting from their first year, going into their clinical years. We asked them to write reflexive diaries. okay, what's working for you, what is not working for you. And in their clinical years, we ask, look back at your anatomy and say, what how you feel about it. And now they are saying they feel prepared for their clinicals, which is fantastic. And we won so many awards as was told before. Some of the international awards still under embargo, including Dean's Award, and it's just a massive. I should thank my team for their dedication to win these awards. And also, we publish multiple papers in anatomical science education, medical education, and some of our activities have been adopted in so many other countries as well. So, how did we do this? This is again an idea that was shared by Dr. Martin Chadwick. If you look at a book, more than 50% of it is space rather than the text. So to understand text, you have to have space. Similarly, students, they need this space to grasp the knowledge that we are trying to say. If we just keep continuously giving them knowledge, it's very unlikely that they'll consolidate this. So the techniques that we used were embedded in these two beautiful books. I highly, highly recommend that you read it. It's by Professor Pooja Agrawal from Berkeley College. Um, and she's a cognitive neuroscientist, and she has incorporated decades of research in cognitive neuroscience and how best to teach students. And it follows three concepts: the retrieval practice, spacing, and interleaving. What are these things? So, retrieval practice is, as educators, when I started teaching, I thought, oh, I have to spend a lot of time figuring out how best to deliver this activity in a way that they will remember it. Okay. Do I need a lot of images? Do I need a different way of, say, instead of a presentation, do I do something else? So I focused a lot on retrieval practice. Focus a lot on encoding, putting things into the brain rather than retrieval practice. So retrieval practice means no matter how you try to encode things, the most important thing for your long-term knowledge retention is retrieval. Try to bring that knowledge that you encoded into brain again and again until it becomes easily accessible. For example, do a lot of MCQs, do a lot of questions so that they again try to bring that knowledge that they try to put in the memory. That will help in long-term memory. Okay, I'll tell you how we did it in our curriculum. The second thing is spacing. If you teach it's one off, they'll not remember it. So we have to try and make them look at the content again and again, or just practice retrieval in couple of times. Like when you teach it first day, day three, release a quiz so that they'll do it. And day seven, try another different type of a quiz. So they will space so that there's time for forgetting, and then you will again learn, reinforce that. And the last one is interleaving. If you just teach one concept in anatomy again and again and move to the next concept in anatomy, it's highly unlikely that you will remember all these things. But if you have something in between, say I teach neuroanatomy and bring neurophysiology at the same time and do a clinical skills at the same time, that is interleaving. So you chunk them and bring multiple disciplines together. It doesn't have, like, you can do an integrated activity, or it doesn't have to be integrated. You just learn anatomy today and then you do a quiz of physiology soon after that, something like that. And apparently it helps in long-term memory. So all these three aspects are backed by decades of research. I highly encourage you to go back and read, and then you'll be fascinated how these tiny changes can help them retain memory for a longer time. All right. Now I'll tell you how we run our anatomy program in our campuses. So all our lectures are online, and we try to make them as interactive as possible. So with the lectures, we have some quizzes embedded, so they have to do these quizzes to move on, or at the end of the lectures, there are interactive quizzes. And this is one such example in imaging. So they can drag and drop. So we ask some questions, they just drag and drop these things and then move. So we have tiny videos and quizzes. Tiny videos, questions, rather than having a big video. We try to chunk them as small as possible, and always try to ask whether they learned the concept before moving on. And also the another important thing is having a lot of feedback, because sometimes students will click and say, oh, my question is, my answer is right, and they'll move on. But the most important thing is they can just guess. If you have a lot of feedback embedded with it, that helps in consolidating knowledge. Nice. And all our face-to-face activities are based on three different types of activities. One is called active learning. The other one is the clinical anatomy workshop and the tutorial. So in active learning, we have these 3D prints. We pin on the structures and ask questions. We simply don't identify the structure, but we link it with the clinical correlation. What happens if we damage this structure? What what nerve will be damaged if I fracture the bone at this site? Something like that. So it's a little bit more applied rather than just distinct anatomy knowledge. And then we started this activity called simulated anatomy ward rounds, because from their third year onwards, they are going to learn through ward rounds, but there was this difficulty in applying the anatomy knowledge. So what we do is we have this uh, tiny simulated dummy, and so we ask the questions. For example, so this 35-year-old patient who came after fall in and now is in the accident and emergency unit, complaining of, say, neck pain. Using this model, can you describe the anatomy? And then we show an MRI and say, okay, there's a fracture here. Can you count the vertebra and identify what this structure is? And which other structures are getting compressed? Is it the chordae equina or is it the spinal cord? So likewise, we try to make them more engaging and active. And students work as a group to answer this. It's not just I'm asking one person, tell me the answer. It's very similar to our clinical settings, right? So they will have to answer the questions together and work things out together. And I see they are answering more and more questions uh, and encouraging their colleagues to answer as well, uh, rather than dominating. So we started ultrasound-based teaching from the first year onwards. Uh, um, the idea is not to teach them the technique of ultrasound, but to visualize their own anatomy through ultrasound. Even in our rural hospital, we have only one ultrasound machine, but we try to teach it. We chunk them into groups. One group will come and learn these. And after like 2, 3 weeks, we can see students are doing it by themselves. So we are not teaching them the knowledge, which, as the literature says, gives a lot of cognitive load. However, what they are trying to learn is, okay, if I keep the probe transversely, what does the screen look like? And what are the structures? Cool. And then we have a lot of other games such as our escape rooms. So the students will have a map. They will go to the different structures, different stations, and they have to solve these puzzles. For example, here they have to arrange them from anterior to posterior. Um, so they have a online portal where they input their answers, and at the same time they have to work through the physical models. Then we have memory games. We try to keep the cards turned upside down, and they have to pick two of them and try to link, is this structure here? Uh, then we have something called a mini twinnies. Sorry, this is the Neuro Jeopardy. Might have heard of Jeopardy. It's like a quiz where they answer in groups, and we have an online buzzer. And credits to Brenda who created this. We just have to click on these questions, and they can select which questions they want to answer, and they have to answer within a given time. We have simple questions for 100 points and more clinically integrated questions for like 400 points. Like describe this clinical presentation based on your anatomy knowledge. Then we have this a label to win it, a mini to win it. So you have different stations. We give clinical scenarios, and you have to label these, say, four structures under the 1 to 2 minutes. Again, credits to Vandana who gave the initial idea of this. We have more activities like matching activities. This is an online portal. We completely converted it to an online activity where we have the anatomical structure and the function. So they'll have to drag and drop, and then they discuss what is going on. Why do you think this is linked to this? So again, credits to Professor David Morton, who kindly shared his uh, resources with me, and I created him into an online portal. Our clinical workshops, because we want to consolidate the knowledge, we bring a clinical scenario and try to ask them what is the anatomy behind it. And finally, we have tutorials. And in tutorials, what we do is we don't teach, we just give students a topic. So they will research it within like 10 to 15 minutes, and they'll come up with an idea which is a very engaging way of teaching rather than us going and teaching them. So this is a set of students doing an interpretative dance called for the song Macarena, and showing them what are these movements, what is flexion, extension on the very first day. And we have the dissections as well in the human anatomy lab, and we have drop-in sessions to answer any questions if they have. The most fun part is we integrated all these games into our entire curriculum, and to make them keep engaged, we have a leaderboard. So in traditional leaderboards, what they have is they have the top 5 points, five say positions. But here, what we try to do was include all the groups. So it goes all the way down. And they have these tiny avatars. They start like this, but they can keep on modifying their avatar. So if everyone in the group contributed the discussion, we give a point using our own website. The students won't see it. And if they gave really good answers, we give points, like, in Harry Potter, 50 points to Gryffindor. So at the end, even if they are not at their top 5 places, they get a score so that they can modify their avatars. And they love it. So these days they are getting FIFA jerseys. They used to get Formula One helmets. You can see some of them. And at the end of the semester, we give this Anatom Cup, and we engrave their team names and the certificates. And Brenda is the one who played a very crucial role in creating this leaderboard. Cool. So now that is what we did. I will tell you whether they were successful or not in a minute. And before that, I would encourage all of you to try this escape room with me. I think we have some time. Yeah. We have around 10 minutes to play this game. And you don't have to try it on your own. I will share the screen and I'll play it, and you can tell me the answers. Would that work, Madhya? Yeah, okay. So we can finish it early. We can finish it fast if you give me the answers. So don't worry. Don't feel pressured. It doesn't have to be like a perfect answer. If it is not the correct answer, we can try something else. This is not a big deal. Uh, but we'll try to. So this is the simplest escape room that I have created. Didn't take much time to create it. I'll tell you how we created it at the end as well. Why it is simple is what I had to do was just pick some MCQs, multiple choice questions, and then we could easily create it. Now I will enter the name as Malaysian Anatomy Association, and let's see if you can break the world record so far that the students have set. All right. I think you can enter the answers on chat, or you can unmute and just give the answers. So this is our story. We have a knight and a square. Can you hear the music? Is it distracting? You can hear the music. Okay. I'll keep the sound minimal. So the story begins in a castle. And in this castle, we had the princess or the queen and the knight, who was supposed to be guarding the queen but was not. And the king found out, and what the king did was, king exiled the knight. Now knight is exiled from the kingdom, and queen is now imprisoned in a tower. After some time, we find out the queen is going to have a baby. Fun. Okay. Now we start our game. We can start the hard mode or easy mode just to make your life easy. I'll go check the easy mode. Okay. Now this is something that we learned from our previous escape rooms and based on the feedback that I got from the students. Just have very clear goal rather than if you have done escape rooms, what actually happens is you are in a room, you don't have clues, you have to find for clues. But the point in educational escape rooms is make it clear. So the whole idea is to learn anatomy, not to, have the full escape room experience. Yeah. So I have all the controls. You can get hints if you want to. And then there's scoring and time. Now, this is something that I'm exploring. It is great to have a time, say 45 minutes to complete the task rather than saying be fast and finish it fast, because what we want is the students to discuss and learn anatomy rather than trying to be very fast and finish all the activities. Okay. So try to give a time and say by 45 minutes, if you can finish it, that's good enough. You don't have to be the first to finish it. But for you, I'm going to make it a competition because you all are anatomists. Okay. Just kidding. So we have a password here because then everyone can start at the same time. Otherwise, they wouldn't listen to our objectives. They'll jump in and start playing the game. Okay. So we have this map. Now in this one, I've created a linear map so that they have to complete the first task and go to the next task. If you have physical escape rooms, what you can do is you can have a multiple, interrelated map so that they can start from anywhere. And so the first question is, now the baby is born and baby has this deformity and baby can't, there's a deformity in moving the wrist and it is pronated. Can someone help answer which region of the brachial plexus is affected? I can't see the chat, unfortunately. If you have an answer, can Dr. Madiha help me?
Yeah, I will read the answer from the chat box. Come on, anatomist.
Okay. Do you have answers? Do you have answers?
Yes, we have upper trunk.
Thank you, upper trunk. So if you're not sure, we can take a hint, but I'm not going to take a hint now because you are brilliant. I'm going to move this away and submit. Yes, great. We clear that room. Now, another thing that I learned was having explanations then and there is very helpful because some students, they just guess an answer and they said, even though you describe the answer at the end, we really want to know it then and there before moving to the next room. So try to have a small explanation then and there before moving on. Okay, you're going to the next. Now the knight is in a faraway land practicing to come back and attack the kingdom. Now knight is doing the push-ups. Can someone tell me which muscle is getting activated in the push-ups? And what is the nerve for that?
Checking the chat box. Someone answer A.
A, great.
Which nerve? Anybody?
We got this. Otherwise, we can get a hint. Thank you. Long thoracic nerve and serratus anterior. Very good. Oh, why did I take a hint? I don't have to take a hint. I can submit. Nice. Great. And we have the explanation. We are moving forwards. I'm going pretty fast. Now the square is very happy and giving a thumbs up. What is the nerve important for thumb extension?
We have different answers for this one.
Okay. We can try both.
I'll just read. We've got B and A.
B and A. Okay, we'll try A. Oh no, it says try again. We'll try B. Okay, chapter clear. So extension, radial nerve. Very good. And now he's practicing so hard and he gets pain in the medial aspect of the forearm. What is the diagnosis here? Because he's trying to flex at the wrist joint. All right, we see that. Medial epicondylitis. I saw the answer. Thank you. Great. Nice. Moving forwards. Now Sky is not happy. He's shaking his head. Which joint is most important for head rotation in a no movement? Got it. Atlantaxial joint. Very good.
Yeah.
Very good. You are amazing. You're going to have make a world record in this. Okay, cool. Now he's going to attack and the opponent falls. Falls on the outstretched hand. What is the most likely structure that can get damaged? There could be any. There could be any. The most likely structure. Yeah, okay, I see. A, distal radius. Very good.
Fracture.
Very nice. You're moving in. Now, what has happened? After the fall, the opponent's hand hangs limp. Now there's wrist drop and finger drop. Which nerve is affected and where would be the fracture? Yeah, okay, we got A. Very good. Radial nerve, mid-shaft humerus. Very nice. And on the other hand, there is severe pain on the anatomical snuff box. Which bone is likely to be affected? Okay, B. You are very fast. Thank you. All right. Now Square has defeated the opponent and now he's climbing the wall. What is the muscle important for this climbing activity? And what is the nerve important for that? Hey, thank you, latissimus dorsi and the thoracodorsal nerve. Very good. Very nice. You're moving to. You are almost there. Now you have to release some arrows. What is the primary elbow extensor when you're holding the bow steady? Yeah, triceps. And the nerve is P. Very good. Radial nerve. You are very fast. Okay. Now we are almost there. Now we are in the tower. What muscles produce forearm supination? Now you're trying to open the door. A tricky one. You may have to select all that will apply. A and B, very good. Biceps and supinator, very nice. Okay. Now we are saving our princess. I'm so sorry about the hair color. Apparently, I'm colorblind, so I did not see this coming. Apparently, it changed from brown to green or yellow. I don't know. Okay.
It's blonde.
It's blonde. Okay, fantastic. Okay, now we are on the rescue.
Brunette in the beginning.
Right, and when we are running back, Square has an injury, hyperextension injury.
Dr. Prem wants more of the story.
Yeah, poor Square. Which ligament is affected here? I lost my chat box. Thank you, Pamela. So the ligament that is on this aspect of the vertebral column. Yeah, it's the anterior longitudinal ligament. Very good. Very nice. And we have the last question. Now, after carrying the queen, the knight is having a lumbar disc prolapse. And he cannot dorsiflex the victor. That's the last question. What's the intervertebral disc most likely prolapse? So this video is not perfect. Yeah, so it's the dorsiflexion of the victor. This is a tricky one. So if it's L5, S1, you are mentioning the S1, that will affect the plantar flexion, I guess. So if it is L4, L5, you are impinging the L5 nerve root, and that will affect the dorsiflexion of the big toe. So this is a complicated one. It's always the nerve below the vertebral level, but you're pretty close. All right. B, we are
This
done.
like the problem with this
All
attendance.
right. So we have a health, time bonus, and a total. Something that I'm going to change for next year is remove the time bonus. We want them to discuss rather than
Oh yeah, okay. Okay.
work
So
to
I
finish our.
Sorry, we are
Yeah.
hearing some
I was having
microphone.
issue right
Can I
with this
please ask
CBSA. And
you
it
to turn
was
off
like
your microphone?
I went clinic, they gave me medication for 2 weeks. When? May, May, June, like that. During serious. During serious. Okay, then. So I missed you
Okay.
coming back.
All
I'm
right.
just okay. Thank you.
Thanks. Yeah, it worked. So again, what I learned was don't have time pressure. Just let them enjoy it and take, say, 45 minutes to complete this activity. Okay. Now I'll tell you if this worked. Now we did some really complicated analysis to see whether this actually works. So we had a sorry, I'll stop my 1 second. I'm still hearing music. I'm going to stop sharing for a second. Sorry. I'm sharing again. Yeah. So we did some complicated analysis to see whether this has any effect. So we had an online version as well as a hybrid version where they had access to the physical resources as well. So the easiest way is to do a pre-test and a post-test and get qualitative feedback. The other complicated setting that what we did was we randomly divided the entire cohort into two groups, group A and B, and we gave group A the questionnaire A, group B the questionnaire B. And we did the online escape room the next day, and we gave the alternate questions the day after. So if they initially did questionnaire A, now they are doing questionnaire B as the post test. Whereas if they did questionnaire B earlier, they are doing questionnaire A now. So it's a crossover design. But the cool thing is, some of the students, they did not do the baseline questionnaire. They were not there on the first day. Or yeah, so we had those as internal controls, and some of them actually they did not do the escape room because it was the next day. So they did the baseline questionnaire on day one, and they did alternative questionnaire on day two without doing the escape room. So we had all these internal controls, uh, like 125 for internal control, and then we did this complicated binomial logistic regression. Uh, and we tested if there's any effect on short-term knowledge. Okay, and this is what we saw. This is a very simplified version of our binomial regression. This is if you might have heard of these general linear models, which are very complicated. You can't show it in a single line like this. But what you see is the knowledge score from went up from 3.9 to 4.4, which was statistically significant, right? So this is after controlling for whether they participated in activities or whether the questionnaire A was difficult than questionnaire B. All these things were controlled. And you can also see the hybrid version post-test questionnaires was statistically significantly different compared to the pre-test knowledge. And also we did qualitative studies, interviews, and they said they think it's a really nice, valuable learning tool. This is based on a Likert scale. And they also said this helps in learning the clinical relevance, teamwork, as well as debriefing. Debriefing at the end, we had a slide to go through the questions again, and that was really helpful. So what they wanted was more time. Initially, we did it in 30 minutes, and we increased this to 45 minutes this year. Group sizes, specifically, they say around 5 members per group would be the maximum. And they wanted more help with the map. We changed it, and the guided debrief, they really liked it. All right, and in the Likert scale, as you can see, the majority say this helps in interactions. It looks very immersive, cognitively engaging, motivating, and it helps in problem solving. Cool. So take home message is this is a really good revision activity. Then we also tried ultrasound again in a gamified way. I'll tell you in a minute. Um, and also we implemented in multiple cohorts, the rural cohorts, the metropolitan cohort, and also in Malaysia, Monash, Malaysia. And we did mixed methods designed to see whether it's effective. And as I described, there are short-term gains. Knowledge is increased statistically significantly. However, we really want to see, is this just a short-term gain? Is there a longer-term gain as well? So we analyze again using a very complicated statistical model, whether the end of semester performance specifically based on the questions that were uh, taught using ultrasound as a principle. It's not just showing ultrasound images in the exam, it's just asking whether this concept was covered in ultrasound or a tutorial, etc. And it looks like ultrasound taught topics have a significantly improved long-term knowledge compared to non-ultrasound topics. And it was very easily, um, 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 uh, I would say, implementable in diverse settings, even with just one machine. You can have a portable machine, handheld machine, which is not that expensive, and we did it in Mildura cohort. And the qualitative analysis, they really, really like it. They say this helps in understanding the spatial relationships, clinical relevance, and it's very engaging. So this is again something that you can implement with a very small handheld probe. Cool. And now, the big question is, as educators, without a lot of experience in game-based theory or game design, can we really implement those things? Yes, you can. If you read this paper in multimodal curriculum with integrated gamification, this is published in Anatomical Science Education. All the templates are given free of charge for anyone to uh, access, and you can modify. The easiest thing is just ask AI. Just put all these things on AI. I'm not telling about the paid versions. I designed most of my escape rooms with non-paid versions. You don't have to know these complex coding. You just have a chat with an AI, and they'll tell you what to do. And there were two students who had no coding experience before me and developed escape rooms within 2 to 3 weeks. And there were educators who had no experience, and now they are developing all these fancy models, um, a, a 3D model of the eye to show these eye muscles. It's fascinating. You can do this with help of AI, and you don't need paid versions. You don't have to have any previous background. And at the moment, I'm working on a methods paper to help this with some videos. Hopefully, it'll come out soon. So, in summary, what I want to say is uh, we find gamification when implemented at the right time and without much peer pressure. It works really well in long-term knowledge retention, and we see all these fantastic long-term knowledge retention gains and exam scores. So if you are interested, feel free to contact me or feel free to try read papers and try on your own, and it'll work most of the time. And also, I'm very open to collaborations. And also, if there are students who would like to do PhDs at Monash, please let us know, and we can do some collaborative PhD supervision. We have fully funded PhD scholarships. Plus, I know some of you are coming to the IFA conference in August. We have HAPS conference on 17th of August, which is the next day after IFA. And we have really nice keynote speakers, and we have hands-on workshops on how to develop some of these gamification activities. So by the time you finish that 1 hour or 45-minute workshop, you will make your own game. We invite you to come to HAPS if you are free. This is happening in the Melbourne city as well, very close to the convention center. Right. And finally, I'd like to acknowledge all my collaborators, David Gonzalez, especially, who is my postdoc supervisor and the deputy director of the center, and all my international collaborators from Spain, Sri Lanka, Malaysia, South Africa. Yeah, thank you so much. I'd like to hand over to Dr. Madiha.
All right. Thank you so much, Dr. Yasid, for such an insightful, inspiring. I'm sure we all really enjoyed the game and highly practical presentation. It is truly fascinating to see how gamification can break the geographic barriers, as you show us the rural versus the city campuses outcome, and enrich the learning experience for the students that we know who are traditionally far from the central resource pool. So it's really wonderful. Just a quick reminder for participants today, if you're collecting your MMC, MAA, CPD points, you need to register through the registration link. So please send us your details and we can process that for your point collection. We will now open the floor. I think we've got a couple of questions already in the chat box. We'll see that first. That's all right. One is from Dr. Norhida. I'll read the question. Right. Thanks, Dr. Yasid. During the active learning, the bedside simulation teaching, what kind of questions usually given to the students? Are the questions highly related to clinical relations?
Yeah, great question. So the questions were not highly related to clinicals. For example, if I give an MRI, the question I'm asking is, can you look at this and identify the anatomical structures that you can see here? Can you identify, is this a lumbar vertebra? Is this a sacral vertebra? And walk me through the nearby structures. So where's the spinal cord? Where's the cauda equina? Things like that. Because what we want to do is to teach anatomy, not clinical, but we tell everything in a clinical story. So all these questions, if you want, if you go to that paper or just email me, I'll send you some all the questions that we prepared for simulated board rounds. So it's not clinical; it's mainly focusing on anatomy, and we tell them reinforce every time. Talk about anatomy. Don't go and tell me how would you like what kind of an MRI would you do to identify a fracture? It's not the point. It's about discussing the anatomy. And specifically, this is important if you are not running it and if someone else, say a junior colleague, a TA is running this, have a meeting with everyone and have clear expectations. We are not talking about clinicals, we're talking about anatomy. Yeah, great question.
Wonderful. Well, we're on that same topic. Can you just tell me a little bit about like how you do that? How many in a group?
Yeah,
And is it starting from year one or you go
yeah.
to year two where they have more knowledge or?
Yeah. No, what we tried was we started from year one. So in our undergraduate cohort, they have 2 years to learn anatomy, whereas postgraduate, they have just 1 year to learn anatomy. So we started from the beginning. The first thing that we did was this back clinical scenario because we started back. Uh, and the group size could vary around 5 to 6, and we have a rubric also to help you give a mark if that is necessary as a formative assessment. What we do is we take them to our simulated board, no patients, it's just simulated patients. And I open up by saying, okay, this is the case scenario, and I'm not enforcing questions on anyone. As you are working in a clinic, I'm going to tell the question, you have to work with everyone, and one person has to come up with an answer. But make sure by the end of the session, I'm going to ask 8 questions or 6 questions. Everyone in your group answers at least one question. And if you don't know, you can pass the question to the other one. So, for example, if they are taking the vertebra model and describing it, one person would come and say, okay, I will help you orientate this. This is anterior, this is posterior, etc. And another person will come and say, okay, the structure's in nearby it. So we have to probe and say, okay, would you like to first orientate it and tell me the structures nearby? Things like that. That's all I do. I don't direct it to anyone. And at the end, I give a summary, like a debrief, saying, "Okay, we discussed these questions, and great that you answered these areas. And this is maybe an area that you can grow on. Say, you could have further discussed the structures inside the vertebral canal. Now, imagine this is a lumbar vertebra L5, so it can't be the spinal cord. What else would that be?" So things like that. So it's question and answer.
Right, great. Thank you. Let's move on to the second question. I think Dr. Azril has a question here. Doctor, can you explain more on the guided debrief,
Yeah.
how it should be done?
Yeah. Sorry, I didn't show it in my escape room. So when you finish the escape room, when you click once more, you can see all the questions there and all the MCQs and a description. This is the correct answer. Why this is the correct answer? Why this is not the correct answer? What we do is we take around 15 minutes and go through those slides, or you can have a PowerPoint slide and say, discuss it among everyone in the group, because sometimes under time pressure they might not be able to discuss and find the correct answer. They would have already gone to the next room station. But what we do is a little didactic activity. We just go through the questions and say, oh, this is the correct answer. And if it is not, why do you think that's not the best answer? Yeah.
All right. I think one more from Dr. Azril also. How do you decide on which game elements to use, or we should mix and match the elements?
Right. Excellent question. So this is a dilemma for us. What game would be best at this stage? So what we found was initially games like memory games, where they look at the name and try to match the picture with those things. Those are really good when you're starting. Then, when you know a little bit, you can do things like a minute to win it, where you have a question, or a Jeopardy, like a Q&A question. But escape rooms are best when you know the entire, like, 3 weeks content and you are testing that knowledge in the fourth week. So in our paper, there is a guidance on when to actually implement these things, or at least what we did. And I'm currently working on another paper to share knowledge, like exactly what's the best element at what point for the long-term knowledge retention. So I'm working with a couple of collaborators from US and in Australia who have done a lot of escape rooms, and hopefully it'll be out soon.
Great. Yeah, actually, I wanted to ask the same question, like what sort of learning outcomes that you for escape room, whether it is a topical based, is an integrated,
Yeah.
for the whole semester or something like that. So I think it's kind of like answering that, and we'll look forward for your next publication.
Yeah, and
Okay.
actually,
Yeah.
this was a purely MSK escape room, but we've tried integrated escape rooms where we have anatomy, physiology, clinical skills, everything coming together, and that was more fun. But for today's discussion, because you
Great.
all are anatomists, I did the anatomy escape room.
What's the frequency of this?
Yeah, so
And you
sorry,
do
I did
that
not hear you
every
properly.
year.
Can you say it
The
again?
frequency. I
Sorry.
was wondering how often did you do this? How often did you do this escape room?
Yeah, okay.
Can you hear me?
Yeah, I can hear you. Thanks. So escape rooms, first year we did only two, and they said this was a really nice activity. So this year we implemented four. So I'm telling about the postgraduate students who are finishing anatomy in 1 year. So we have around four escape rooms per year. And simulated ward rounds, I did two in the first year. And then I got feedback and they were like, just do more. And at this year we did four, and they're asking for more. So it looks like that's a really good activity to consolidate knowledge.
Okay. Next one. I have one question from Dr. Deepa. Interesting presentation, Dr. Yasid. How
Thank
could
you.
you space this gamification? I think it's almost similar to what I asked earlier,
Same.
but
Yeah.
how could you space these gamifications during a routine lecture or any dedicated sessions? Let us know how you could incorporate ultrasound-based sessions in the beginning itself.
Yeah. No, great questions. We did not increase our teaching activities to have gamification. What we did was we tried to deliver some of our teaching activities in a different way using gamification. Okay. We have 3 hours per week to do face-to-face activities. We don't have lectures, face-to-face lectures. All the lectures are online, and we can have the same amount of face-to-face activities, that duration for a lecture. So we try to finish lectures in like under 1 hour for every week for these face-to-face activities. What we used to do was a lot of things like flag races, where you have these 3D prints, they go to different 3D prints and try to identify the structures. But we found that's pure anatomy, it's not clinically integrated. So that's why we try to introduce these gamification element. So this the game that we played was a replacement for that flag race kind of activity. Now they, instead of going and trying to identify where the radial nerve is, where the ulnar nerve is, they will do this activity, which will deliver the same learning outcomes, I believe. For ultrasound, uh, my advice, the things that I learned from last couple of years, is keep it extremely simple. For example, if it is upper limb, um, I have three learning outcomes. One would be look at the carpal tunnel and identify where the median nerve is, and just move your fingers so you will see where the tendons are. And in the cubital fossa, identify which one is the artery, which one is the vein. You might not see the nerve here. And in the say near the clavicle, you can see subclavian artery, subclavian vein, and brachial plexus as well. So I ask clinical questions. Can you find the brachial plexus? Is it on the medial aspect of the clavicle, or is it towards the lateral aspect? So where do you usually fracture a clavicle? So I'll have a skeleton and I ask them to find out where the thinnest part is. And I ask, in that kind of a fracture, would you usually damage the brachial plexus? So it's a conversation type. So you can start it on your very first day. So they only have to know what structures are there, like if you do regional anatomy, if you only do here to here on the first day, just do this region and the cubital fossa. So you can do it from the very first day onwards. And happy to give you the worksheets or teaching guidance that we've developed if you email me. And also that paper is also currently under review. So if it gets published, all these resources will be available for everyone for free.
Great. Couple more questions here. One is very quick one. So when you mentioned the lecture is online, is it synchronous or asynchronous?
It's asynchronous. So a week, roughly week before we open the lectures to students, and they can decide when to watch it.
Okay, great. Okay, one more. That was from Dr. Azril, the previous question. One more from Dr. Arthur. I try to apply, I think we're probably going to have the same dilemma here. Try to
Yeah.
apply game-based learning into my teaching, but curriculum is hectic and stakeholders are not keen because of stigma towards the game-based learning. I showed data, but they're still not keen. Any
No.
recommendation to solve this?
I was going to say just show data. Okay.
No, we need more data then.
Yeah. So I'm fortunate because our team is very keen to try out new things. What I do is, this is data. These people have done this, and I know there are some other really prominent scientists in the game-based learning out here. Like I can see Arthur. Arthur will give you enough data to show that yes, this helps in long-term knowledge retention. So why don't you try it? The only thing is, if the curriculum is hectic, identify some learning outcomes that is not getting repeated by the game, but it's replaced in the current activity. Say what we used to do was we used to body paint and surface mark, and we replaced that activity with the ultrasound, which does the same thing, right? So yeah, give it a try and paper based.
I think we need to find a formula to balance the curriculum.
I know, I know.
All right. One more from Dr. Azri again. If I think it's about the lecture, online lecture. If it is asynchronous, but obviously you mentioned that it's synchronous actually, then how we make sure the student read the content before the face-to-face activities? Do you do like a checklist or something?
Yeah, it's a
Yeah.
good point. It's a good point. So I can check in Moodle how many of them have seen them. Uh, Usually they watch them at least around 70 to 80%. If they don't watch it, it's a bit tough. But even if we deliver a face-to-face lecture, we're not sure if all of them grasp it, right? And current evidence suggests having chunked lectures asynchronous, actually it gives them time to consolidate, because they will take notes, they will watch it, rewind it, and watch it again. So that's a current policy at Monash. As of now, in any course, in all the courses, we have online lectures. We don't have face-to-face lectures anymore. Again, that is a change that Monash did based on current evidence. So it might work. Give it a try if your institution allows it.
Okay. All right. I don't see any more question on the chat box, but if anybody wants to just turn on your mic and ask question, probably we can take at least one more question. Yeah, if not, I think we should be ready, for the picture photography session. Okay, any more questions? Okay, I think we don't have any more on the chat box. Okay. All right. Okay, so thank you everyone for provoking questions, and some are really we're sharing the same wavelength. And thank you so much, Dr. Yasid, for the brilliant answers and elaborations. And there were some really practical solutions there. We really hope that more of us can try out the interesting. I'm already having some ideas of what to do next in our next anatomy teaching. Okay, so before we officially sign off and end our webinar today, we would love to capture the memory of this session. So I kindly invite all participants to turn on your webcams for a quick virtual photography session. Our technical team will take a few screenshots. Okay, so
all right. We have 5 pages here, so smile, everyone. On smiling.
Keep smiling, okay? Which page are we now on?
We are actually just that page. Hold on, you have to paste it first. Right.
Okay. All right. Keep smiling, everyone, because we don't know which page we are on. Okay. Any more?
Yep. Okay, one last one.
Okay, that's one.
All right, done.
Okay, thank you so much once again, Dr. Yasid, and everybody who participates today. Hope to see you soon in Melbourne for IFA, and where